Okay, welcome to the Community COVID-19 Task Force for Wednesday, September 16th. You can see on the agenda that, yes, once again, I put the wrong date, but I apologize. We have right now a quorum of 5 that may go to 4 in the near future, and then we would not have a quorum. I'm still expecting others to join. So before we begin, let me just, so we can get this out of the way, let's talk about what comes up next. I'm thinking we ought to have a workshop setting in our next meeting where we would take the workshop and plug it into where we would normally do subgroups, and we'll take the subgroups out so we can think about how we, and I'll put together an outline for the workshop, send it out to everybody. We'll plug it into the agenda as a group. We can agree on all that. And some of the topics could be like reviewing our body of work so far, what improvements we could make to our health and safety management in town in the future, what infrastructure changes would we make. I went over to the beach to look at entryways, and some of those ramps are like treacherous. And so even in good times, not so good. But I was thinking if everyone, then we could talk about what our frequency of meeting would be. I wouldn't say we need to disband, but I think our frequency after we have the workshop at our next meeting in 2 weeks, we might want to consider a frequency of once a month, depending on what happens. And then if the issue doesn't go away, we will revert back to in the spring or late winter back to this format, but we can discuss that next week. So, and I see Charlie's here and Rick is here. Thank you for joining. So I'm just talking about our next meeting. Maybe we have a workshop plugged into where the subgroups are, and so that we can talk about what we've done, where we've been, what we need to improve on, what we need to improve on in the town, what infrastructure changes we make, and what kind of meeting frequency should we have, and what other changes that we can make to the meeting to make it viable now that the summer is winding down and the population of visitors is diminishing. Does that seem like something we should do for our next meeting? I won't call a vote, but I think if
No, it's Pam. I actually think that's a great idea, considering that I believe Oktoberfest has pretty much been canceled. There's a few events that they've downsized that dramatically. Christmas by the Sea will be downsized, if at all. Some of the other bigger events that we always have that time of year, the Spirit of Giving, and that at Main Street, that won't be happening. So I think a lot of people will not be here. So the attention that we have been giving to the amount of people, the congestion, the safety of the population will change. So a workshop is good to strategize where we want to go from here, and come the spring, if we're still in the same situation, make some recommendations even to come out of that workshop, how they can improve on the beach and improve on stuff.
Okay. Any other comments? Any other comments on that? Oh, Alice. Alice is here.
Sorry, I'm late. Just got off a phone call.
No problem.
I have to leave about 4:30 just because we have a chamber event that starts at 5 up at the Hill Farm.
Yeah, we were all talking about how we didn't get our invitation. So yeah, that's great.
Well, I see somebody on.
I'm kidding. I'm still 11. So look at Buzzy. Buzzy's very upset. He wanted to go out today.
Buzzy, that was me. You saw. I think you were. I was picking up pizza, and I saw your Bernie shirt, and I said, "Hey, hi!" And I don't think you knew who I was because I had my mask on. But when I saw the Bernie shirt, I knew it was you.
I get a lot. I get a lot.
Okay, so I will then, unless there's further comment on that, I will prepare a detailed workshop outline for our next meeting based on some of those topics. Send it out to you. You guys make additions to that, and then we'll proceed with a workshop at the next meeting, and then we'll determine where we go from here on that. We do have minutes. Some people haven't been able to read them. I don't know. I think well, we have a choice. We can take the minutes up at the next meeting, or we could take them up here. What say everyone? Let's just go for the first one, July 1st. Are there any changes to the minutes of July 1st? Any issues? No? Okay, let's entertain a motion then for July 1st minutes to be approved.
I make a motion they be approved.
Okay, so Pam, motions to approve. Buzzy, seconds. All those in favor, say aye. All those no, and all those abstaining. Okay, so we have 2 abstentions because they had already told me. Oh, Alice, are you an abstention?
Yes.
Okay, 1, 2, 3, 4. 4 yes, no nos, and 3 abstentions. Okay, let's go to the meeting minutes. And if you have any issues with the minutes after you get a chance to read them, I learned that I went to a seminar sponsored by the state of Maine, and the seminar said never use Robert's Rules of Order anymore because it's too complicated. So think about that one. Wednesday, July 8th minutes. Do I have any changes or amendments to that set of minutes? Okay, seeing none, entertain a motion then to accept those minutes. Buzzy, who I almost called Bernie again. Buzzy makes the motion to accept. The second, I'm going to go with Rick because he seconded the other one. All those in favor, say aye. All those abstaining, say abstain. That's 1, 2, 3, and there are no nays. Okay. Move on. All right, CDC update. Charlie, do you think Eric is going to be with us today?
Charlie, you're on mute.
Still
Charlie,
on mute, Charlie.
All right, it wouldn't let me unmute. I apologize. I was pushing the button and it wouldn't unmute. So before I start, I would like to ask, speaking of the next meeting or maybe the meeting after that, I am the liaison to our representative, Patty Hymanson. We have not had her on yet, and I'm wondering if anyone thinks that would be helpful to hear the legislative angle on this thing. To hear from her, especially now that there are cases spiking in York County. So I thought I'd throw that out there and see if that's something that might be helpful.
I disagree. I don't think she needs, I think it's much more important to have Eric because it's in York County and that's where he is, and it's too close to election.
Well, she's different than Eric, obviously. She's a legislator. She's also a doctor, but that's what I'm thinking. We haven't heard from anybody in, a legal capacity or in a legislative capacity. And I thought that might be helpful, but anyway, I'll let it go because I'm cutting in on my time and I want to hear from Eric as well. So I'm looking at numbers. I did go down through Wells, York, Kittery Point, all the 03 zip codes. And we're still the lowest in the 03 zip code area. They don't list us as any number. They list 1 to 5. The next lowest one in the area is Kittery Point that has 10, and that's only part of a town, sort of like Cape Nettic, which is 14 people, have 14 cases, I should say. I also looked at the ages again, and once again, it's the highest rate is among the 50-year-olds. It's pretty close to what the 20s, 30s, and 40s are as well. They're all around 15%, with the 20s being at 16.9 and the 50s being at 16.3% of the shared caseload, of the shared cases that have been diagnosed. The 70s and 80s remain around 7%, but as we all know, that's where most of the deaths occur. I went by county, and York remains the second highest county, right behind Cumberland, actually quite a ways behind Cumberland. Cumberland County has twice as many cases at 2261. We're at 1,017 cases with a rate of 49.3 cases per 10,000 population. Cumberland's at 77.0. And statewide, we're at 36.9 cases per 10,000. I did give the male to female rates last time, and the number that kind of is a little skewed here in the male to female, they're pretty close. They're only 100, a little over 100 more females, women that got diagnosed with COVID-19. But the deaths, there are 73 deaths in women and 65 in men thus far. Hospitalizations are quite a bit higher in men for some reason, 244 to 189 in women. So I don't know the correlation there,
Women are tougher.
Well, that might be it. Better immune systems as well, something like that. I did go and look at the worldwide cases real quick today, too. There have been 937,000 deaths thus far, 29.7 million people diagnosed with COVID-19, and 20 million have recovered. In the US, 6.63 million cases have been diagnosed. They didn't give a recovery rate, who had recovered, but 196,000 deaths. I'll leave it at that and turn it over to Eric at this point. Thank you.
Good afternoon, everybody.
Afternoon, Eric.
So I'll tell you, things have changed quite a bit, at least in my world. I kind of came in at the end of Charlie's comments, and I always appreciate going over the numbers. I've been on the phone all afternoon with Maine CDC and my contacts there. We're dealing with probably 11 plus or minus current outbreaks in York County. Most of them are in the Sanford area, but go down as far as the Kittery shipyard. We're talking large numbers of people requiring tested currently. Just since I spoke to you 2 weeks ago, we've had 4 hospitalized patients. If you recall, we went from June up until recently with none. And what always worries me is one of our hospitalized patients is a 40-plus-year-old, otherwise incredibly healthy person who's in our ICU struggling. So feeling a lot different, I think, this week reporting to you than I have in ever, I guess. We did see an uptick in the number of tests performed at my test site. If I recall, 2 weeks ago, I told you we had started to trickle down in our number of testing. We are picking back up again. But the other thing that we're watching is our gating criteria, and our percent positive went from last week 0.5% to 2%. Although that doesn't sound great, huge, it is a 4-fold increase in just 1 week. So those are trends that we are uncomfortable about and are certainly watching closely. So there's no doubt there's community spread in York County. There's no doubt that we are having more and more cases every day come out positive. I see it in my own testing. We were hoping that this wouldn't happen in our great state, but we have made the world news. As you know, we've made the national news. Everyone has reported on this super spreader event that continues to, we're up to 7 deaths, I believe now, tied to the Millinocket wedding, and over 170 or so cases, either directly or indirectly related. So that's our current state at York Hospital, and glad to answer any questions.
Any questions for Eric? Buzzy.
Eric, how you doing?
Good, my friend.
Good. This is our first meeting, COVID task force, ever when we're in the color code yellow. We've never met in yellow, so this is it. We're really in it right now.
You
And
bet.
Eric, you can tell by your demeanor, the seriousness of the situation. My question to you, Eric, is about children and testing. And how many children are you testing? Do they generate bills for the parents, or can a child get tested 3 or 4 times over a course of a month and not generate a bill? And are you seeing a lot of children being tested? Thank you.
So I'll attack that. That we are starting to see more children being tested. Where some of the schools are starting to trickle in. Right, this week we're starting to see back to school this week. We are seeing a slight uptick in testing children, but not nearly the group that we're testing now seem to be workforce folks and coming from businesses and whatnot in the central York County area. As it relates to bills, there's several ways the state has set up testing. A lot of these swab and sends, the one at the Kittery drive-through, for example, the one at Nassau out in Springvale, those are all CARES Act sponsored test programs, so they are free. They don't bill. The areas doing the testing gets a nominal fee for doing that, just like I do for our rapid program. Our outpatient program, we bill through insurance. Because of the CARES Act and the Family First Act that were all due to COVID, there should be no cost to patients, either shared costs, either copay or any cost incurred by patients having to do with COVID treatment, COVID testing, COVID management. So we haven't seen that an issue. If you're uninsured, there are grants available through the state that help support paying for testing for anyone who doesn't have the either insurance or means to pay. So that hasn't been an issue.
Thank you. Thank you.
You bet.
Okay, Rick, next.
Hey, Eric, how are you?
Okay.
Curious if if all of these cases, how many of them are interconnected with the initial case of the wedding and then the changes, and then also the other piece of that, or are we seeing the results of Labor Day gatherings right now? Because I felt that around here Labor Day was relatively ugly as far as respecting the rules. And I don't mean that everyone, but it felt a little uncomfortable for me as I was looking around. And I'm just wondering if some of this is results of that weekend, or if it's connected.
Yeah, what I can say about that is I believe the lion's share of this seems to be interrelated to the Millinocket wedding, particularly these Sanford cases. So the Baptist Church, the jail, the Sanford Fire Department, the American Legion. There was a funeral that was held in Sanford, I think a week and a half ago. Then there was a reception or a gathering after that. But I think the connection to that all stemmed from an indirect contact at the wedding. The shipyard outbreak now, which seems to be hard to get a sense of because that information isn't as public as some of these others, is harder to, I don't know what the contact tracing is showing there, but I will tell you that I was originally going to do about 100 tests of shipyard employees yesterday, but the CDC has now come in and taken that over. So they did not come to us, which tells me that the outbreak has gotten pretty big if the CDC is involved. I can simply share that. But I can't quite say. I know a lot of people that work at the shipyard come from quite a bit of ways, and I would imagine a large percentage of those come from the greater Sanford area. So I could only speculate that may have a connection there as well. I haven't heard yet of anyone tying anything to the Labor Day long weekend and those activities. But that's not to say it isn't, but I haven't heard that.
Eric, the shipyard, how many positive cases have they reported to date?
Publicly, we're reporting 4. Anecdotally, I hear 40 plus. Some of my spouses work at the shipyard, so that's where I get my information from. And the fact that 100 plus people are requesting testing tells me it's bigger than just 4 cases. So I understand it's part of too how they transport. So I understand these shuttles that meet in Waterboro, Biddeford, and I think there's some exposure on some of the transportation shuttles is what I was hearing. So my sense is it's a pretty decent outbreak.
Thank you.
You bet.
Charlie.
Hi, Eric. Just wondering, we're in yellow here in York County. Is Cumberland County in yellow as well?
No, my understanding is the only yellow is Penobscot and York County, both again tied or connected to that wedding.
So what would be needed in order to not be in yellow any longer?
I think the state, and I think that the designation comes, it's through the state, but it's really the Department of Education, I think, that determines that setting. I don't think it's any of the other. And I think they look at activity and new cases coming out of a certain county. So I think there's some threshold. I think it's a % positive. So I don't think, Charlie, they publicize what those thresholds are. There was even some thought that they might go red. I think they're looking at them weekly. Every Friday at noon, they make those announcements. And there was some concern that last Friday it would even go to red. So we're going to have to watch closely this week, because the cases certainly aren't going down. They seem to be going up. So there must be a point where it goes from green to yellow and then from yellow to red. But I'm not aware of what that criteria is.
Yeah, that's what I heard. And I tried to look it up, and I guess that I think you're right. The school department is the one that, and I couldn't find much about it because I work part-time at the school. They called me in and asked me to come in, and the protocols are really safe. I feel safe there, and I don't come within 6 feet of anybody while I'm there and everybody's wearing masks and everybody's sanitizing at every turn. I think they're pretty good, but the concern was, like you said, that we would go to red possibly this Friday. And if the uptick continues, it may be, maybe coming up, this Friday, it may turn to that.
Yeah, and I think Lawrence just clarify that York is only yellow. I think Penobscot and York originally were yellow, and maybe Penobscot was able to meet some threshold and get back to green.
Well, I know Penobscot's numbers. I'm looking at them, and they're, the percentages, are quite a bit lower than us and less population, obviously. But I think because they're able to social distance easier, probably it's not going to go up much there. That may be the reason. Who knows?
So when I just hung up with Adam Hartwig from the Maine CDC, his last comment was, "There's a big problem in York County right now." That was his comment to me. And Adam, I've been talking to since April, doesn't get too rattled. So.
Any other questions for Eric? Okay.
Well, stay safe, everybody. I'm here if you need me. Reach out, and we'll talk to you soon. Thank you all.
Thank you.
Thanks, Eric.
Here. All right, Tom is our representative from the town. So Tom, you have the floor.
All right, thank you. So I apologize, my update isn't all that lengthy. Probably okay with that. That's just last minute for me. So some challenges we've had simply is staffing. So we have almost no CSOs left for, usually it's a summer gig. We tried to get some of the lifeguards who are still around to try to do some of kind of CSO responsibilities to help out with that. And I'm not sure where it's at with that. So we're doing our best to try to keep staffing up to have people out there. We're still giving out plenty of masks. We got rid of the mailboxes. We ran into some issues with that. People were taking more than their share of masks out of the mailboxes. So we fill them up and then we turn around and they're empty. There were some, disagreements between attendants who saw people taking masks. So we just scrapped that idea because it wasn't working out. The number of people getting masks wasn't enough. Let's see. There were a couple issues with people on the marginal way being uncooperative, being unpleasant to CSOs. Not a huge thing. We haven't seen some crazy uptick in the amount of people that aren't wearing masks. And probably oh yeah, so we still have the weekend details as well for an officer to be at beach locations, entrances. Part of that is weather dependent as well. If it's a crappy day, there aren't a lot of people around. So with weather, we might not have somebody out there, but that's still available. The details for an officer with a cruiser to be out at the entrances, the busier areas. We were able to put some more cameras out in more areas around town. So we don't have them up yet in the Cove, but we have cameras at North Beach Lot, Footbridge Lot, Main Beach Lot, on the lighthouse that sees both ways of the Marginal Way and up Stearns Road. So we're continuing to get more cameras out so we can continue to monitor areas and send our resources where they need to be since they're more limited. I think that's it for updates. I'd be happy to try to answer any questions.
Tom, this is Pam. I have one question. You said you do not have cameras in the Cove at this time. Is that correct?
Yeah, they're going to be up very soon. Just a matter of them in the line of when things are going up, but we will. Hopefully by next meeting.
Well, that for our meeting is 2 weeks, but I mean,
definitely then.
Because I have been in the Cove recently, and I have seen probably more activity in the Cove than down on the beach in the last 2 weeks. There's literally no parking down there. There are lots of people mulling around down there. So, I think the sooner you can get it up there, the better.
All right. It's good feedback too, just so we can, I don't know exactly what the staffing is. I don't deal with the staffing for CSOs. I don't work during the day either, so I don't even see them coming and going. So
there were no CSOs down there at the time. There at the weekend, there were the visitor services people, but and I didn't see any reserve or officers down there at all either. But I mean, people-wise, there are a lot of people.
Right. Yeah, and I'll certainly pass that along to the sergeant who does the scheduling for the summer reserves and CSOs to try to see if we can focus our attention down there.
You said that there were little to no CSOs. Are there any CSOs? I guess my question is still
yes. Around? Yeah, we still have a reserve officer who's here a couple days a week, and I know there's at least a couple of CSOs who are still around, but they're not. They weren't the 40-hour-a-week CSOs, so I don't know if we even have them every single day of the week, just because we're working with a handful of people who are all very part-time.
Okay, thank you.
You're welcome.
Any other questions for Tom? Okay, thank you, Tom. I have a question for Charlie. Go back to zip code data that you mentioned. How recent was that zip code data for our community?
Well, I pulled it off the web today. I didn't notice what the date was on it. I think it was as of yesterday, but I can't remember what it said, to be honest with you. I pulled it off just before our meeting, actually.
Okay.
On the CDC, main CDC website.
Yeah,
Right.
which means it hasn't changed. It has been exactly that since they started reporting. So I'm wondering, if there has truly been any change.
They update it periodically, and it's usually the day prior, like Charlie said.
Okay.
Yeah.
So we've not changed at all during this whole thing,
Right.
Despite the fact that we've had big crowds at the beaches and big crowds on the Marginal Way, which is excellent.
Yeah, but they were all from away. They wouldn't report as Ogunquit. It wouldn't show in these numbers.
That's true.
It's true, but I'm they've left, and I'm concerned about our residents who do live here. So it's good to know that our residents are still safe based on that data. I'm not saying it's perfect, but at least from that data, I think that's a good thing to look at. Terry Ann.
Yeah, listening to the CDC briefing yesterday, the only thing that I would like to caution us about is that Dr. Shah said, even though, particularly in York County, you haven't had any cases in your community, you need to be vigilant and continue to do what you've been doing, because the fact that you don't have any cases in your community, we do have community spread in York County, and they're very, very concerned. So the fact that in our little 4 square miles with our small number of people, we haven't seen any cases. We're not immune immune to community spread. So I think it's interesting that we haven't had the numbers, but I really don't think, given where we're headed now, it matters that much.
Charlie,
Hey, I recently completed a bicycle tour starting up at Fort Ken and went through many of the counties in Maine. And as a matter of fact, I had my meeting today of the Bicycle Pedestrian Committee, and John Cavaretta, who's on the committee, owns a home up in Piscataquis County, I think. I'm not sure which county that Moosehead Lake is in. Anyway, he's up there and he said, you wouldn't even know there was a pandemic up here the way people walk around. They don't have masks. They don't social distance. I mean, they don't gather in big groups, but I agree. I saw exactly that when I was in Aroostook County, when I was in Washington County, until I got down to somewhere near Bangor. You wouldn't even know in a lot of cases. People walk around without masks. And so I think that's possibly because Millinocket's in Penobscot County. That may be why, they had let their guard down during this wedding up there. And unfortunately, it's affecting us quite a bit down here. I think that may be the reason, because they had such a low incidence up there and people weren't as concerned and as vigilant. So Terry Ann brings up a very good point that we need to keep our nose to the grindstone here in Ogunquit to make sure that we don't end up being like, some of the other communities here in York County.
okay. Let's move on. I think, Pam, you're going to depart now, or are you going to stay with us? You're on mute, Pam.
I am. I'm going to depart now. Thank you all, and I will see you in 2 weeks when we do have our workshop.
Okay.
Pam.
Bye-bye. All right. So I'm just going to go through the names here, and you can talk about what's on your mind. So we'll start with the Kent group. Rebecca is not on the call, so it's all Kent.
She's finally taking a vacation and wasn't sure she could get connectivity, and it looks like she couldn't. I have only a little bit of data, and it just shows trends in parking lot volume versus the same periods last year. So for the month of August, in the aggregate for our parking lots, we were at almost 94% of where we were for August 2019. Of note, Main Beach showed 106% of last year's numbers, as did Footbridge. And Perkins Cove was slightly higher than last year at 101% of last year's volume for August. For the month of September to date, the aggregate we're showing the decline that we expected to see. The aggregate through September 13th is 72% of where we were through September 13th last year. Footbridge Beach month to date is at 103% of last year's numbers, but everything else seems to be falling back in line. Main Beach at 83%, and that's an exact match to July, and nothing else really stands out there. So we're seeing the drop-offs that we expected to see across all of the lots. So an indicator that town volume is going down. I think, Bob, the paper that Becky sent out after our last meeting to the task force members, were we going to discuss that today, or do you want to table that for the workshop next week?
I think the
Or 2
page
weeks.
that was in the content there works really well for the workshop. And if we have everybody at the workshop, I think that also is important.
Okay,
So I think that was my thinking here.
perfect.
That would be I can try to include that a little bit into the preamble here. So
Okay.
if that's okay with you.
Okay, with me. That's it from the data group then.
Okay, thank you, Ken.
So,
Terry Ann and Buzzy,
I'd like to let me see.
you're on mute now.
I'd like to make a recommendation that we as a committee make a recommendation to either the school department, the superintendent, and the select board about moving cautiously as we're opening the schools right now. You see in Mr. Fogg's face the severity of this situation. We're in yellow. We're going forward. It's getting worse, not better. And our superintendent and our school board are moving forward. And I'd like to give them some guidance to say, let's start thinking about, safety over normality, or healthcare over daycare. I'm not saying they're making bad decisions or uninformed decisions. I would just like us, the committee, say, whoa, there's no rush into this thing. And it's better to look like over concerned with this than under concerned. I know Charlie had told some anecdotal information about being in the schools and feeling really safe. I love that. But no one's been in the schools yet. The schools have not been filled yet. There's been only one grade at a time, and they haven't gone. And we're going to make a decision tomorrow whether to go hybrid A, which is basically just full metal. It's only just, the only difference is the A is you have a separation. It's really not any change. Now, our schools were taken out when we were in green last year. We're in yellow now. So I would like us to maybe put together a letter or some type of advice to the council, school committee, or superintendent that we think we'd rather err on the side of caution in this situation. Because, it's not the tourists that brought this here. We're swimming in it ourselves right now. And we can easily blame people for Millinocket or something like that, but we're in it right now. And so we need to own it. And that means taking some serious steps to let people know that maybe we should slow down. I'm not talking about tourism or inside dining outside. I'm talking about the children, whether they should be going back to school, at what level, and whether we should be ahead of every other district, or should we be in concert with every other district. The districts we're neighbors to, Kennebunk, York, and Sanford. We should be in line with those a little more than trying to be a front runner for how to get back to normal. I don't know what the letter would look like. And again, this is not a critique of any of the school board or anybody, but I think if we're going to do something, this committee should make a recommendation to err on the side of caution when dealing with the children in the schools, as with the teachers, the lunch cafeteria workers, the bus drivers, all that entails. We saw Eric talk about getting tested. We're not having kids get tested a lot. He was pretty sure you're not going to get a bill, but there was some other things where you're not 100% sure. We need to have it clear that if you can want to take your kid to get tested, there's not going to be a bill, there's not going to be anything. And then we can work back. Because people will not make the right decision when money is involved in this situation. We put in a bad spot. If I get my kid tested, then I have to pull my kid out. Now I have to be home for 4 weeks or 2 weeks or whatever while the child heals. It's a lot going on. So I'd like to just see what other people think about that idea.
Charlie,
Yeah, having been in the school for 2 days, Monday and Tuesday, Buzzy's right. There's fewer kids, but not just one class at this point. It was one class last week, Buzzy. There were about half as many kids. As a matter of fact, Monday there were 174 students at the high school. I'm talking high school only. I don't know about the other two schools, the middle school or the elementary. And it's worked well with about half the students. I don't know what would happen if we went, like you said, full metal with all the students, because if all the students are in, it's just under 400 at the high school. So that's a little scary, bit of a scary proposition, especially in yellow at this point. But I will report what I saw was made me feel comfortable. even at my age being there, because like I say, all day long, I didn't come within 6 feet of anybody. And we encouraged everybody to do the same. And even during lunch, they can't sit at the same table. They are separate seats, especially then. And the distance was more like 8 to 10 feet in lunchtime because they don't have masks on at that point. So they have to eat and drink. So anyway, I'm fairly comfortable with what I saw the first 2 days. Other than that, the full metal thing, I don't know, that remains to be seen because I haven't seen it yet. And if it does go to red, there's going to be nothing, they're going to shut the school down.
Okay, anyone else want to weigh in on this topic? Carrie Ann.
Yeah, I just want to echo what Buzzy represented from our discussions. I think high school is one thing, but elementary school and middle school is another whole ball of wax. And in Kennebunk and in York, they're moving more slowly than our school district. And remember, we are part of the Wells School District, and we contribute a significant amount of money to the school district. And I think it's makes sense for us to urge caution and to err on the side of safety, particularly for young children. And with things increasing here, whatever has been planned should be revisited in the light of how things are changing here. So I really would like us to urge caution, whether we recommend that the select board communicate with the school committee and the superintendent, or whether we do that directly. I think it's really, really important that we at least make a statement of caution. To not do that seems like we would be abdicating our responsibility given the data that we have right now.
I'd just like to add, just full disclosure, my wife is a speech pathologist and I have 3 children in the school department, in the schools. So, I mean, I'm a little more maybe vested than someone else. I get that, but this is not about me. It's about across that, just a letter of err on the side of caution instead of moving forward just because we can. It's going to be something that we can say. And again, I think it's something we should all talk about, because what else are we here to do?
So full disclosure as well, I have a lot of trust in the principal and the superintendent, but I agree 100% with Buzzy and with Terry Ann that we as a community and as a task force have I would say probably an obligation to put forward, because I feel very comfortable with the hybrid model. But I've had a lot of thoughts about if everything goes full bore, that's a scary prospect.
And Rick, do you want to weigh in? No? Okay. Oh, go ahead. No. Well, my personal opinion is, I don't think it's our responsibility or our charge to make a comment to the superintendent and whoever else is managing the school district. Now, having said that, we can do whatever we want as a task force in terms of health and safety and making a recommendation for proceeding with caution. So maybe you can flesh this letter out here a little bit more while we're talking. What are we trying to say, Buzzy? Are we trying to say you should shut down the school, go slower, wait till October? I don't think it's prudent to say we should advise caution. That's just way too broad for me. If we're going to make a stand and say something, then let's make a stand and say something. And if it means, I think just telling them, oh, please be cautious. Well, I think they're probably thinking in a mentality of caution. I wouldn't think they would be thinking in a mentality of recklessness. I mean, that would be pretty silly in this day and age and the pandemic. But if we felt like, as a task force, based on the data we have and what we know about York and what Eric has said, you should not open schools until October 1st. Then that, I think, that has meaning. I'm not saying that that's my position, but that's what I'd like to hear more in a conversation, personally.
I disagree trying to give parameters to the professionals. What I want to do is know that we were the only district going full in York County as of 2 weeks ago. So what I'm saying is that we've been going a little more aggressive than the other school districts have been. And so what I would say is just a letter from the COVID task saying we urge caution moving forward without giving you parameters or telling you how to do your job or what is that we want you to seriously think of this, that there's people out there who think that the slow and safe is a little bit better than let's get back to it. And I appreciate you want to give some parameters, but I think just some basic ideas that we feel concerned. The community feels concerned about moving forward without any, we haven't even addressed this. I mean, we have not even talked about children, schools, teachers, any of the community, and that's part of the COVID task. So whether we send a letter to the superintendent and whether we send a letter to the school committee, I say we send a letter to all three, select board, school committee, just saying we urge caution. You define what caution is. If you don't do what we feel is cautious, then we can address the steps that we think you need to do. But I don't want to go and tell someone, superintendent or the school committee to urge like, oh, you're being crazy. I want you, we're aware, we're concerned. We appreciate your concern. We just want you to know that we are. And that allows them to maybe think for a second, hey, instead of just going forward what we think, you know what, there are people who are going to be pumping the brakes on this thing, and we should take that in consideration. Because I'm telling you, I'm hearing more care about daycare than healthcare. And that's a big problem, especially in an elderly community like Ogunquit. Okay, and the spread is not coming from outside, it's circulating in York County. So that's again, my thoughts.
Okay, so Terry Ann?
I would just add part of what's happening now, I think just like the hospitality industry, our schools are getting a lot of public pressure because parents want their kids in school. And that is an overwhelming set of pressures that schools are trying to deal with. And I think communicating that we are with them and we urge caution and we support, they're taking a second look at going full board, given what's happening in this county, provides them with some support for doing something different and perhaps being somewhat of an antidote to the kind of pressure they're feeling. And I don't think it's dissimilar to the pressure that the hospitality industry is facing in our state to loosen up. So I really think it is appropriate, even though we haven't been very focused on education, I think it is really important for us to focus on that because that's what's happening right now. So I don't think even though I get you, Bob, about not making concrete recommendations, I think urging and supporting the school system to take a second look and to feel like we're there to support what if they make decisions to go slower. And in fact, we would urge them to do that. So I don't think it's a problem to support thinking, erring on the side of caution when it comes to kids.
And
So I agree with what Buzzy and Terry Ann are saying about protecting our youth. I just wonder if the approach that we talked about is outside the scope of our charter, where we're supposed to be reporting to and making recommendations to the select board. Maybe there's a different route to make some of these recommendations or have these discussions.
If that's the case, and I totally agree, Ken, if that's the case, then just a letter to the select board. A letter to the select board urging our concern about the current situation. We don't have to send it to the superintendent or the school board. I agree. This is our charge, to wave flags at things we see problematic as conserving to the community and COVID. I'm waving this flag. I mean, Eric Fogg was just on here. His face alone was concerning enough. We've gone up 40% in the last 2 weeks was his numbers, from 0.5 to 2. These are drastic changes. And if we act as if, oh, don't worry, it's going to go red or it's going to go yellow or it's going to go like, we would fail ourselves if we didn't say something. I mean, even if they were doing a good job, say, school board, select board, you guys are doing it great. We love you. Everything's right. We should be saying, hey, just a heads up. We're worried about this. This is on our radar and we hope it's on yours. Wherever it goes from there, let it go. That's not the problem, but we did our part.
okay, so we have one issue, and that issue is we can write a letter, but the letter's got to be public. So we'd have to have another meeting tomorrow if you're going to write a letter tonight, for instance. So the reason I'm telling you this is I just got schooled in the state's right to know law. So, I'm telling you, and they're very serious about it.
Yeah.
So had we come to this meeting with a letter that we could all read and vote on and then send it, then we could do that. We will need to direct someone to craft a letter, then we'll need to debate that letter, then we'll need to publish that letter and vote on it. Publish, I don't mean publish anywhere, I mean in terms of we have to show it to the public. And then we have to vote on it. By Friday, we could be in red. I'm not saying we should, I'm not saying we shouldn't urge caution. I have no problem with that. I agree with Kent to some extent. Is this really our charge? I don't really think so, but I also don't think we lose anything by following your lead. I don't have a problem with that. But I do have to manage the task force in a way that keeps the public in view. So we would need to vote now to charge somebody with the responsibility for writing a letter. And then I need to give ample time to call a meeting, and it says ample time. And I will say, you ask everyone, what's ample time? Well, it's 3 days. The lawyer said to me, this is not our lawyer, this is the lawyer on the training I went to, said, 3 or 4 days. That's generally what the state recommends. So we'd have to have ample time to give the public. We could probably do it in 2 days and not have a big issue. There's certain committees kind of go with their own little flow, I guess, to some extent. So what I'm saying is, to stay within the boundaries, we would have to now entertain a motion, and I'll entertain a motion that we assign the public health group to craft a letter, and then once the letter is crafted, they notify the chair, and the chair calls a meeting. That's the way it works. So, Terry Ann?
I get all the public meeting stuff, but I don't see why we couldn't make a motion to recommend to the select board that they express what we had a full discussion today. And if we all agree, or the majority agrees that we would like the select board to reach out to the school committee and to say the following things, I don't know why we make recommendations to the select board coming right out of our meetings. We've done that every time we've made a recommendation without spending time drafting a letter, without having to have another meeting to look at the letter. I don't quite understand what's different about this.
Terry Ann, repeat that, because I think you said we didn't spend time on our recommendation?
No, I said in the past, when we've made a recommendation to the select board coming out of our meeting, it's come at the end of our meeting when we've had a full discussion about what action we would like the select board to make, and that's it. The recommendation goes to the select board. I don't understand why we would have to take another, I don't understand enough about, FOIA and all that would require us to draft a letter. Why couldn't we just make a recommendation to our select board? And as we did before, you, Pam, and I were authorized by the select board, by our committee, to put something in writing to communicate to the town manager the set of recommendations that we discussed at the meeting. So I don't quite understand. I'm happy to do whatever you want to do,
Okay,
but
Terry Ann, first of all, for most of our major recommendations, I put together spreadsheets in advance of the meeting and brought those to the meeting, and we discussed those and amended those at the meeting, and then voted on them. So I did that in advance of the meeting. I didn't walk into the meeting and say, let's make a PowerPoint. I brought the PowerPoint to the meeting based on all the inputs from all the sections of our town. And that's what we voted on. We didn't just walk in and have a discussion and say, okay, this is what we want you to do, select board. That was an organized message that we put together, and it worked. And it made the things we wanted to convey, we made it work. Now, Terry Ann, you have the right as a member of this task force to make any motion you want. Here, I can entertain a motion right now and call for a vote. So you have that right. If you wanted to make a motion that we craft a letter that goes to with the basic content, we could vote on that motion. That's not an issue. And I've never said that anyone couldn't make a motion, ever. So you're welcome to do that, or Buzzy's welcome to do that. We're all welcome to, but don't try to portray that we just kind of happenstance to discuss something in a meeting and then went on a beach proposal, or the chamber put a lot of work into their proposal, brought it to the meeting for businesses. That's how we made most of our major recommendations. We had some issues at the beach, and the task force decided to authorize you, me, and Pam to go talk to the town manager. And we met and then went to the town manager. So it wasn't like, a hop, skip, and a jump. It was, we met, we went there was discussion, and there was an outcome. And we put together a quadrant analysis to do that. So there was real work that went into that. And I go back to what I said earlier. You can make a motion, but if we're going to make a motion on, okay, we're just going to make a letter that urges caution, that's fine. And I don't have any problem with that. But it's not going to be, there's going to be no, other than our discussion, there's not going to be all that much there, except let's be cautious. Buzzy.
Are you going to be speaking at the next select board meeting, Bob? Will you be at the next select board meeting?
I am invited to every select board meeting, and I only go if there's something that you as a task force.
We could vote on a motion for you to urge caution to the select board moving forward as it goes to opening of the schools. That's all it has to be. So I am going to make a motion that at the next select board meeting, Robert, you tell the select board that we are concerned and we urge caution when it goes to opening the schools.
Okay, I have a motion on the floor from Buzzy that says, I will go to the next select board meeting for which I normally am invited 99% of the time. And I only go if there's nothing been recommended, but we have a recommendation on the table. That motion needs a second. Terry Ann seconds that. All in favor? We're going to do a roll call. Well, let's do a roll call because this is a recommendation. So it's going to be a roll call. So you unmute yourselves, and we'll start with Kent.
Do we have discussion or have we asked that?
Well, technically, Terry Ann can say it. She made the second. She can say second for discussion. Would you like to second for discussion, Terry Ann?
Absolutely. Mhm.
So
Okay.
we're clear on the motion, what the recommendation is, to just voice our concern or to voice our concern and present recommendations for the select board to reach out to the school board and with a letter or bullet points or a phone call or something like that. Are we going to recommend something that the select board do or say?
Okay. Buzzy, you want to answer that or comment
I
on
would
that?
say, Ken, at the next time, as we move forward, we will be crafting those things. We can find out what the situation, because the situation is it's so tenable. I don't have a problem waiting 2 weeks. I mean, we're probably going to go red in the next couple of days here. I don't want to, but just to get something on the books that we move forward, you make this recommendation, Bob, just that we're concerned and we urge caution. That's it. And then we will follow up. If they have questions or charge with us, the select board, they can come to us. We will address those and we'll keep moving forward and we'll be flowing with the situation that is unfolding and as the time goes on. We may get really good. We may go back to green, and then we can say, listen, we appreciate your time and effort and you listen to us, or maybe going red and we're like, we think these ideas might have some, but just those words at the next select board meeting, if Bob be so kind, is what my motion is.
Okay. Any further discussion? Okay, seeing none, I'm going to do a roll call based on what I see on my screen. So Kent,
Yes.
you said yes. Buzzy,
Yes.
Rick,
Yes.
Charlie, Terry Ann.
Yes.
Okay, and my vote will be a yes because of the majority, and I feel like it's my responsibility to go to the select board as the chairman of the task force based on this vote. And I'll say nothing more about my personal opinions, but that's my responsibility as the chair of this task force. Okay.
Appreciate that, Bob. I appreciate that big time, what you just said. And I understand it.
Thank you. Okay. Pam is not here, so Charlie, you get to talk again if you want to.
Yeah, I've been in touch with Southern Maine Area Agency on Aging and 2 or 3 other organizations, the AARP. And there really haven't been any changes of the recommendations for at-risk, especially older populations like myself. And had there been anything new, I would have brought it to the task force for sure. But it's the same old with masks, hand washing, sanitizing, social distancing. So I think it's been proven that those things actually work. And I'm just going to leave it at that for our at-risk group at this point. If anything news comes up, I will certainly report that. Thank you.
Okay. Thank you, Charlie. And on this note, since there's still more time, I went and looked at the US CDC on death from COVID-19 and age. They have a nice document here that shows, and it does obviously show what we all talk about it. The elderly population is the most at risk for death. One thing that's very interesting here is infants have a higher mortality rate from COVID statistically than children 1 to 4 or 5 to 14. Now, they also have a massively statistical chance of death from all other cases because infant mortality is still an issue in the world, including our country. So I urge anyone who wants to understand the outcomes of the disease to go to the CDC because they just published this on September 9th. So you may want to take a look at that. Okay. Alice is not here, so Rick and Buzzy, you have the floor for business situation. Oh, and Rick, I think I missed you again, didn't I?
All right, there's not much to talk about anyhow. That's all right.
Yeah, but there is one thing, and let's go back to citizens. Do you think at some point we ought to take, maybe not now because we have this spike, but at some point we should be, because we're getting a lot of questions like, what can I do in town? You know, what's open, what's not? It sounds
They're
like
more chamber-related questions than COVID-related questions.
And I'm not sure we need to be, managing those kind of questions, but there haven't been many. So we'll leave it up for a little longer, I think.
Yeah. Yeah. There's nothing with that. As far as businesses, I think we haven't actually even met and spoken in a while as our group, but I think we're going to be looking at what's going to be happening for the businesses as the weather starts to turn, as the people start to have to go inside if they're going to eat or they're going to do takeout, those as far as restaurants. And the same with shops, probably won't really change that much for them because they're mostly indoor anyhow. But actually, I did want to make a statement. I want to follow up on what Terry Ann was saying earlier about being more aware and vigilant about what we're doing, because it feels like, okay, Labor Day's gone. It was crowded. It was busy. There were a lot of people gathering in a lot of places. So we made it through. We're done. Let's go back to normal now. And then the weather change sort of adds to that feeling. And I think we need to be very careful. And I think as the town needs to stay on top of the restaurants and the shops and the lodging facilities and any business, and make sure that we're not starting to slack a little bit, because it's, as we see, it doesn't take much for this to spread and to change very quickly. So that would be my only recommendation that maybe we make to, I don't know how we take that to the select board and say, hey, make sure everybody's doing their job. But that's kind of what we have to I was thinking about, so.
Okay, thank you, Rick. Buzzy?
Just the only thing about the business is Kennybunk just said they're going to do Prelude. That's like a town commitment to a big influx of people. That's a little troubling for me. Ogunquit business has been doing really good, just dealing with it without traveling to get this massive, was it Capriccio or Carpaccio or whatever that is? Yeah. Nice.
Capriccio, yeah.
I like raw steak and coffee with steamed milk. Either way, I don't have any, what are we doing? Do we have plans on going forward, or what are we thinking for any big functions? Now, we don't really have those on the docket. And I mean, nothing we do in Ogunquit kind of compares to Prelude. In fact, Prelude, we will feel the effects of it in Ogunquit. I know many people who come to Ogunquit, stay in Ogunquit, and then go to Prelude during the afternoon and evening festivals. So we'll feel a little bit. I just don't know if we've decided where we stand on, should we be going, come on in, or we should be just like, come, wait, we don't know. I don't know if we have an idea or a plan. It's more of a question than a thought.
I think, well, as far as what the chamber with Ogunquit Fest is going to be modified to be events that are nothing group related. Anything that, if people want to walk around and look at the scarecrows and decorated houses and vote on the best one, things like that will happen. Possibly the kids trick or treat can happen because they're no different than them walking in a store or whatever. But any of the gathered events will not be happening. So Christmas by the Sea has not been officially decided what's happening yet, but more than likely it's going to be very similar. So I'm not even sure how Kennebunkport can do Prelude in a safe and responsible way, right? given today's, where we sit today. I'm kind of surprised at that, actually.
Thank you.
Maybe, I don't know anything about Prelude. I don't even know when it is or what it is.
Welcome to Southern Maine, Bob.
Yeah, you guys do a lot of stuff here. You know, that's good, I guess. Maybe Alice has contacts with the Kennebunk chamber. Maybe they can, maybe we can ask her to find out what's really going to happen there.
And it may be that they're doing some similar things with minimizing a lot of their events, but I don't know that right now.
Okay, thank you. Tom, it's time for public comment. Do we have any hands raised?
Tom?
Tom? Sergeant Tom?
Yes, sorry. What was that?
Ground control to Major Tom.
Yeah, I was gonna say, I was thinking the same thing. That's bad or good or funny. Tom, do we have any hands raised?
There are no hands raised right now.
Okay. And there is no public comment. We do have our motion, which we have already acted on, so we don't need to go there. Is there a motion then to adjourn? Buzzy, do I have a second? Terry Ann, all those in favor? Aye. All those opposed? Have a great evening, and we'll be in touch. Talk to you soon. Thank you.
Thanks,
Bye-bye.
Bob, before you go,
Yeah.
Buzzy and I would be pleased to help you with some bullet points about our motion for when you go to the select board, if you want our help. So just let us know.
Okay, so what I would suggest, in order to stay within the guidelines, which I promised I would, since a conversation between you, me, and Buzzy is not a quorum, you are welcome to make those recommendations to the chair. Because it's not a quorum and it does not require a vote if it's not a quorum. So
Okay.
Thanks.
you are welcome to send those to me. Okay, great. Thank
Okay,
you.
thank you. Bye-bye.
Have a nice evening. Bye-bye.